Ministry of Public Health of Ukraine. Krok 1. Medicine. Year 2017. Number 025. At the 2 to 3 day after the gastric resection, the patient's intestinal peristalsis failed to restore. What should the patient be prescribed to stimulate the function of his gastrointestinal tract? A. Proserin. B. Atropine. C. Dithyline. Suxamethonium chloride. D. Platyphyllin. E. Cyclodol. Trihexyphenidyl. Proserin neostigmine inhibits cholinesterase activity by overdosage of tubocularine muscle relaxant, used in intestinal atony, to improve neuromuscular transmission for disorders of movement coordination and muscular weakness after poliomyelitis. It blocks the active site of acetylcholinesterase so the enzyme can no longer break down their acetylcholine molecules before they reach the postsynaptic membrane receptors. This allows for the threshold to be reached so a new impulse can be triggered in the next neuron. The answer is A. Proserin.